You need to memorize the entire good medical practice guidelines to get a good score for the professional dilemma section. It's impossible to get a high score without prior NHS experience. Your first instinct is always the correct answer. What other myths have you heard about the professional dilemma section of the MSRA exam? Well, these are just a few that I came across while preparing for this exam. You know, for a lot of us, especially the IMGs, those who didn't train in the UK, the professional dilemma section of the MSRA is quite new territory. And so in our quest to find out how best to approach this exam, we've sought for knowledge and information from different places. And we may have come across conflicting advice like what I mentioned in the last few seconds. And that is why I created this video. This video is to explore some of the common myths surrounding the professional dilemma section and acquire the right information necessary to tackle this exam. So stay tuned, subscribe if you haven't, like this video, leave your comments in the comment section if you got any questions, and let's get straight into it. Hi everyone, I'm Maro. I'm a doctor based in the United Kingdom, and I create videos to help others preparing for the MSRA exam. I also create lifestyle content for IMGs settling in the UK. This video is all about exploring the common myths around the PDS section of this exam. Some of them may have sounded confusing, some of them we might have bought into, but we just want to explore some of these common myths, understand why they might be misleading, and really just discuss what we ought to know in order to perform well on the exam. First up is the idea that the professional dilemma questions are just common sense questions. Many people think that because the questions or the scenarios explored are about handling different situations, so it's just best to go with what feels right or what feels straightforward or obvious. But the professional dilemmas are designed to test your ability to judge and make complex decisions under pressure and evaluate multiple aspects of a situation. And your judgments and your ability to make these decisions should align with what the GMC has outlined in the good medical practice guidelines. So even though it may seem like common sense, yes, your answer should actually reflect that you're not just a safe doctor, but you're a doctor who prioritizes patient-centeredness, ethics, and you act in a way that reflects your compliance to the GMC's good medical practice guidelines, not just relying on what you would naturally do. All right, so the next common myth is that there are no right or wrong answers. This is a big one because yes, it does feel like because the professional dilemmas are appear to be subjective tests and the answers seem more open-ended compared to the clinical problem-solving section, it does feel like, okay, there's no really solid right or wrong answer. However, there are certain responses that are strongly preferred, and the scoring for these tests is based on best responses as selected by experienced healthcare professionals who have been involved in curating the scenarios and selecting the most appropriate rankings or answers per question. So think of it this way. There might be a few acceptable options. Some answers, however, are clearly better than others because they align with best practices and patient safety guidelines. So even though it may feel like you have some freedom, some answers will definitely score higher than others because they represent safer and more professional decisions. Another myth is that your medical knowledge is all you need to do well on this part of the exam. This is not true. So the SJTs or the professional dilemma questions are less about clinical knowledge or textbook knowledge and more about your soft skills like communication, empathy, and sensitivity, your ability to make sound judgment given non-clinical scenarios. So these are what are tested by this part of the exam, not necessarily whether or not you know the 5 differentials of headaches or paraparesis. So this means that the SJTs have been designed to assess qualities like teamwork, good communication, respect, integrity, rather than just clinical know-how. And interestingly, these soft skills are what both patients and your colleagues at work will remember about you compared to whether or not you're like textbook smart. So if you're spending all your time on the clinical studies and neglecting the SJTs, you're doing something wrong. Now, some candidates actually believe that the SJTs don't need preparation. I've mentioned this several times. Please don't make this mistake, okay? You cannot just wing it. Let me tell you, preparing can make a huge difference. Even if you're naturally good at communication and teamwork, understanding and actually studying certain frameworks like the Good Medical Practice Guidelines and NHS core values can actually make a big difference in how you're able to approach different scenarios that you'll come across on the exam. Because these guidelines give you an idea of what best practice looks like. So taking the time to review these guidelines can help you make choices in line with professional standards, which is basically what this part of the exam has been designed to test. Another big one is your first reaction is always best. Many people go into the professional dilemma section of the exam thinking that they should just follow their first instinct. While this might be right a good number of times, if your first instinct hasn't always been in line with what has been laid out in accordance with the good medical practice, you might struggle to get a good score. So while intuition is important, it's better to pause, reflect, and think about what aligns with professional standards rather than just going with your gut feeling. The best answers in the SJTs usually come from careful thoughts and an understanding of the bigger picture, like patient safety, professionalism, and communication. Taking a moment to ask yourself, what could be the safest and the most ethical action in this situation can actually help you to make the right decision that aligns with professional standards rather than your natural instinct. So this will help you avoid impulsive answers and choose the most appropriate and thoughtful response. Another common myth is in the ranking questions, the highest ranked answer should be done first. But the reality is that not every problem has a clear-cut answer and requires an immediate response. So it really just depends on the scenario and the context in which the situation has been played. Some scenarios need a combination of different actions and involve steps that need to be prioritized carefully. For example, sometimes you might need to prioritize the patient's safety over a more long-term solution. Other times, you might need to consider the different elements involved in bringing out a resolution of the problem at hand. So you really just need to remember that context is key. Context is key. A lot of people also think that SJTs are only about morals, like what is the right thing to do. But they're also about practical decision making, handling conflicts, and managing limited resources. In some scenarios, you're going to have to balance what is ethically right with what is realistic and effective. For instance, it's not just about what is ideal for the patient, but also how to communicate with their relatives, or handle disagreements with team members. So SJTs really just test your ability to think practically and find the best solution for everyone involved, not necessarily just having the moral high ground. And finally, there's a myth that if you've got lots of clinical experience, especially within the NHS, you'll definitely do very well in the SJTs. Well, clinical experience definitely helps, but these tests are designed to measure specific competencies. If you rely solely on experience and don't take time to understand what the SJT format values, you could overlook very important details. So just think of the SJTs as a way of reflecting on how to handle scenarios in a standardized way, regardless of what you might have done in the past. Preparing with this in mind, rather than just relying on past experience, can help ensure that you perform well. So there you have it. These are some of the most common myths about the SJTs, and I hope that I've been able to help clear them up. Remember, professional dilemmas are about more than just winging it or going with what feels right. They're about thoughtful decision making that aligns with professional standards. And this requires adequate preparation and familiarization with the concepts, the principles, and the things that really the GMT just wants you to imbibe. So thank you for watching. If you found this video helpful, please like it, share with others who you think will benefit from it, and subscribe for more helpful content like this. All the best in your preparations. Bye.